This month, in advance of an extraordinary meeting of EU health ministers on the 12th of October, the European Parliament's Environment Committee assessed a strategy adopted by the European Commission on dealing with the swine flu pandemic. But how serious is the virus really? And are measures dealing with the pandemic effective? In April of this year, Mexican health authorities issued a nationwide health alert following the death of 20 people from a flu-like illness. By the end of that month, the deaths had been linked to other cases across the globe. The new virus was thought to have originated in pigs and was given the name swine flu. A pandemic was later declared by the International Health Organization. The H1N1 virus, or swine flu as it is commonly known, is a type of influenza containing segments of genes from pigs, humans and birds in a combination not seen before. It is a respiratory disease with similar symptoms to standard seasonal flus. By the 29th of September, 174 cases of swine flu were said to have been fatal in Europe and another 4,043 worldwide. But scientific reports suggest that only people with existing health conditions are really at risk from it. It is the spread of the illness and its possible mutation into more serious strains which causes concern. German MEP Peter Liese is also a medical doctor. He believes that the risks should not be underestimated.
Until now, it is a very mild disease. We have a lot of infections and only few fatalities, but it is serious because, as I said, we are out of the season, and during some 3 or 4 months we may see some much more fatalities, and that's why I think it's very important to have the right prevention strategy.
On Tuesday, the Commission announced its authorisation of the first 2 vaccines against the virus. Developed in Britain and Switzerland, it is hoped their availability ahead of the flu season will help stop the spread of swine flu in its tracks. Pressure on healthcare services and an impact on the tourism, retail and leisure industries, for example, are just some of the reasons the Commission is pushing for a coordinated response to the pandemic. MEPs questioned Health Commissioner Androulla Vassilio in the Committee on Environment, Public Health and Food Safety in Parliament on Wednesday.
The most important thing for us was coordination of member states. We have to coordinate our actions, coordinate the way that we communicate with the public, and of course our efforts for the production of the vaccine, which at last we have.
Although the handling of the swine flu virus lies mainly with member states, Mr. Liese told us shared strategy and resources would improve the effectiveness of measures taken across the EU.
But we can pool our expertise, and this is what also the EPP supports, that we have a clear advice, agreed scientific advice from the European institutions like the European Centre for Disease Control, the ECDC, and from the European Drug Agency, the EMEA. And their advice is clearly that we should vaccinate people with risk.
In the European Parliament, the head of the Task Force Against Pandemics, David Harley, explained what measures the Parliament has taken.
First of all, maximum information to staff, to members and to all the external staff that come and work in our buildings every day. To stress to them the importance of personal hygiene and hand washing. Secondly, coordination with other institutions. Thirdly, coordination with national authorities in the countries of the 3 workplaces. Fourthly, daily updated information from the most reliable sources of worldwide information on the spread of the virus. Fifthly, the likelihood that over the next couple of weeks we will be getting vaccines from the Belgian authorities.
According to Parliament calculations, between 8 to 12% of staff will fall ill with the swine flu, and at its peak, roughly 20% will be absent either through sickness or to look after a family member. The authorisation of 2 new vaccines by the Commission this month will help combat the spread of the swine flu virus. But the European Centre for Disease Prevention and Control say that by washing or disinfecting your hands frequently and not touching your eyes, nose and mouth, you can also help avoid transmitting the illness. For more information on the group's policies on swine flu, visit our website eppgroup.eu. Thanks for watching and stay healthy.